My name is Terry Bremner, and I advocate for the Chronic Pain Association of Canada. This presentation is Chronic Pain 101. Most all of us have experienced in our lives acute pain, whether it's from a severe cut with stitches to a burn to broken arms to broken legs to surgeries, hip replacement, knee replacement, dental procedures, labor and childbirth. These are all forms of acute pain, and acute pain could last up to 3 months. They resolve and heal over time, and pain medication that may be prescribed at that time could be Tylenol or ibuprofen, and quite possibly a narcotic for 3 days. Chronic pain is a disease. It has no bearing on age, and it has no bearing on the severity that it inflicts onto an individual. I have lived over half a century in pain. As a child, as a teenager, as an adult, and now as a senior. Chronic pain is pain that's reporting to last longer than 6 months. That could be from a long-term illness. It could be from a vehicle accident, an accident at your home, an accident at your work. It could entail headaches, arthritis, non-cancer pain, nerve pain, back pain, or even that F word, fibromyalgia, which is very, very difficult to diagnose, number one, but it's even more difficult to treat. Chronic pain is invisible. It's an invisible disease. Whether we have, if we don't have a wheelchair, or if we don't have crutches or a cane or a brace or a cast, it's very difficult for individuals to see the pain that we're in. And we, as handicapped individuals and chronic pain sufferers, encounter many circumstances when we pull into a handicapped parking spot and go to get out of our vehicle without one of these devices. Statistically speaking, chronic pain, the Canadian Pain Society says that 1 in 5 Canadians suffer from pain. That's the same number that they have been giving out since 2001. I myself feel that the number is higher than that, and it could be 30% of Canadians that could be suffering from pain at any one time. That's over 11 million Canadians. There's usually a family member or a friend also that's coming down the road with us to help lead us into the right direction. We have many hills, hurdles, and obstacles. The wait times to see a pain specialist. Usually after our own GPs have exhausted treatments, therapies, and medications, then we get a referral to the specialist. To see a pain specialist in Canada, the wait time could be from 8 months up to 24 months. In Halifax a number of years ago, there was a 5-year wait to get into the pain clinic. Chronic pain individuals, the cost for treating chronic pain exceeds heart disease. It exceeds cancer. It exceeds AIDS. 80% of all doctor appointments have a pain component attached to it. Chronic pain is most non-reported from individuals older than 65. People have come to believe that since they're older, that they should be in pain, which is not true. There's no blood tests. There's no blood test to determine the severity of the pain. We run into problems with education. A 4-year post-medical program in universities in Canada, most all only have study of pain for 1 day. I have met many pain specialists across Canada that have admitted to me that they didn't go to school that day. Now, our cats and our dogs and the pets that we love, we take them to our veterinarian, and our veterinarian treats them, and that veterinarian could have up to 7 times the amount of pain study as the GP. I wonder if we should go see our veterinarian next time we have a flare-up. Chronic pain sufferers have many symptoms, but many of them are very similar to each other, whether it's fatigue or sleep or anxiety or anger. We wear a mask on a daily basis. Very few people see through our mask. The consequences of chronic pain, physically, until we get up and put our feet on the floor, we're not really sure how every day is going to go. Whether it's sitting, standing, or walking. Socially, we tend to stay away from large crowds and bright lights and even family functions, whether it's a Christmas party or a summer barbecue. Emotionally, we're very concerned over our health as it's getting difficult to treat in living with chronic pain. We have mortgages, we have bills, we have to be involved in paying our bills. Our mental well-being, if we're not getting a paycheck, we can feel that we're not bringing much into the household. And mental well-being goes with depression. Depression and chronic pain go hand in hand. How would they not? You usually have lost your job, lost your benefits, and lost your support systems. Spiritually, many of us go to church, have gone to church and pray, though many people have questioned their own beliefs and are unwilling to put themselves back in amongst these crowds. Challenges, we're good people. We're a good person, and we have to tell ourselves that. These challenges, navigating through insurance forms, navigating through CPP disability forms, navigating through workers' compensation forms, doctor forms, it becomes very difficult. And it seems as though nothing's helped. Though there is one bright star and there's a golden egg in Canada. Unfortunately, it's not across Canada, it's only in selected areas. And the golden egg is a multidisciplinary pain clinic. Chronic pain is complex and confusing, and it takes many specialists to treat. A psychologist, an occupational therapist, a nutritionist, a physiotherapy, a dietitian, and many more professionals to help treat us. The impact of chronic pain, we've lost our career, our dreams and aspirations, our education, our work seniority are now gone. A number of people are fortunate to have benefits that help pay for their therapies and their prescriptions and treatments, though many people aren't. Many have lost their benefits and do not have access to these services. Financially, many live paycheck to paycheck, week to week, month to month financially, and how long can we go without our paycheck? We've had to cash in our registered retirement savings. We've had to cash in investments to pay for treatments and therapies. And on top of that, we have bills, and we have to pay these bills. How long can we go without a check? Some have lost their marriages, their relationships, their friendships and family. I believe we live in a two-tier health system. 2 weeks ago, Timmy went to see the doctor reporting hip pain. The doctor gave Tim a prerequisite for x-rays, and he's making an appointment for a CAT scan, and once that comes back, then a referral will go into an orthopedic surgeon, and hopefully in 18 to 22 months, Timmy will get a hip replacement. The other patient, Sandy, went to the doctor that same week, complaining of the hip pain. The doctor immediately sent for x-rays and then did a consultation with Sandy on Friday, and Sandy is scheduled for hip surgery on Tuesday. What's the difference between these two situations? Timmy's a 55-year-old heavy equipment operator, and Sandy is a 10-year-old chocolate lab. If my dog laid in the backyard with a broken leg and cried all day, it wouldn't be long before the police are there, the media is there, animal control's there. I could get fined. Though as a chronic pain person, if I was in the backyard or you were in the backyard and we were crying, would anyone listen? Would anyone hear us? Would anyone care? Thank you for watching this video. I hope it was helpful, informative, educational, and please share with anyone you know that suffers daily with chronic pain.